High school sports are supposed to build confidence, character, and maybe a decent highlight reel.
Yeah. But between endless tournaments, bad recovery habits, and year-round competition, too many young athletes are building chronic pain instead.
Yeah, from sprains to stress fractures, we're seeing kids train like pros before their bodies are even done growing.
Today, we're talking with Dr. Taylor Premer, a sports chiropractor who spent years on the sidelines helping athletes move better, recover smarter, and actually enjoy the game again.
Okay, so whether you're a parent, a coach, or a former teen athlete with permanent turf toe, this one's for you.
This is The Pitch.
What happens when a chiropractor and a physical therapist get together to make a health and wellness podcast?
But chiropractors and physical therapists don't like each other.
Oh, think again.
I'm Dr. Kathy Lynch, physical therapist who likes to help people move and get stronger.
I'm Dr. Jason Young, an evidence-based chiropractor who uses humor just as much as adjustments to help people get better.
Welcome to The Pitch Podcast.
Remember, there's no I in pitch. All right, everybody, we are back to The Pitch Podcast.
Here it is.
And you know what it means when we have these headphones on? It means that we got a guest, a call-in guest.
Yes, from Mars.
I know. It really feels like we get to play podcast whenever we got the headphones on.
Got all your gear on.
Yeah. I mean, no, I was going to compare us to Howard Stern, but we're better than that. Yeah, we're good people.
Yeah.
We're really good people. So not Howard Stern.
And this is PG rated.
It is. And, as always, this is the part where we talk about how the show's killing it. Show's still killing it. So totally like and subscribe. Like, if this is your first time listening to us, just go ahead and hit the like button because otherwise you're going to be like, why did I wait so long? Why? Right? Oh, okay, fine. I'll subscribe. Okay. Well, let's just jump right into it. We have a guest today. Our guest is Dr. Taylor Premer, who's the founder of Premer Health and Performance. He's a chiropractor with significant experience working with high school, collegiate, and professional athletes, helping them to stay healthy and to perform at their best. Premer Health and Performance is in Lincoln, Nebraska, which is right in the middle of the country, so everybody can get there, right? If you're listening to this, you should go to Premer Health and Performance in Lincoln, Nebraska. And that's where Taylor's joining us from today. Dr. Taylor Premer, can you hear us?
I can. What's up, guys?
Well, we're so glad to have you here with us today. Fun fact about Taylor.
Yeah.
And that is that his wife's name is Taylor. Yes. Taylor and Taylor.
The better Taylor's at home right now.
Okay. All right. We'll have her.
The second rate one.
Yeah. We'll have her on next time. So, but yeah, Taylor, thanks so much for being here with us. You doing good today?
I'm doing great. Yeah, I'm excited to be on the podcast. Been a listener for a while, so I appreciate you guys inviting me. So it's good to see your face again, Jason. We just saw each other not too long ago. So.
Yeah, up in Portland. Taylor was up presenting at the University of Western States, also known as the Harvard of Chiropractic
I've
Schools.
heard that from someone else before.
I'm sure he would disagree because you did you go to Cleveland? Cleveland. All right. In Kansas City. Yes.
Is that the Yale of chiropractic school?
Yes.
Princeton?
It's definitely that. I was going to say something mean, but Taylor's actually smarter than I am. So it would really be dumb to be like, that's the community college of chiropractic schools.
Community college is great. Don't knock it.
Yeah. You know what's fun is they used to so I argue too much online about chiropractic and the thing people say, name me one public university that has a chiropractic school. And you know what? University of Pittsburgh just opened one up.
Boom.
So it's like,
there you go.
Bam, take that. And Troy University is opening one too.
Nice.
And so it's like, boom, there forever goes that thing. Yeah, it's kind of fun, the silence that happens after you actually rattle one off. So. But yes, so Taylor, the thing that's special about Taylor is Taylor has, I said in here, significant experience working with high school and collegiate athletes and even pros too, right?
Yeah, that's right.
Yeah.
That's
so you were practicing in St. Louis, that area. And so you've done some work with St. Louis Cardinals?
Secondhand, yeah. A lot of my experience with the professional athletes is following around my mentor, Brett Winchester.
Yes.
He was the chiropractor for the Cardinals for 5-6 years, something like that. But then also we had a little continuing education company where we'd travel the world to teach and sometimes there'd be some pros that would be in the area that could use our services. And so, I got to meet and work on some pretty amazing people and things like that. But I will say,
Give
I've
us
worked
all
with
their
professional
names.
sleep.
We don't do HIPAA
Yeah,
here.
no.
Give us
Yes,
all,
every
just-
single one of them, their injuries, but I will say, like, I don't love working with that population, to be completely
Mm.
honest with you. Like, I would take a high school athlete any day
Mhm.
over a college athlete or a professional, and the
Mhm.
reason is why I'm so passionate about it is because they are excited to be there. They're excited to feel better, and they want to perform, which I think is going to be one of the topics we talk about today. Is that
yes.
they're so excited to get back on the field, the court, whatever it might be, that sometimes the health standards get very low with them, and so that's what I'm passionate about is raising the level of not only education but also treatment that these high school kids receive. Because I was a kid, growing up in tiny little town in Nebraska. I had 30 kids in my graduating class, and I was plagued with injuries and had no help. And so
Mm.
that was my why, and that's why I'm kind of so passionate about this, is to help kids like me to not only get back on the field but maybe perform a little bit better.
Love it. And that's kind of the reverse of what everybody thinks the
Yeah,
trajectory is.
everybody wants to work with professional
Oh
athletes.
yeah, I only work with
Mm.
pros. Yeah, just pros.
I
Oh,
get questions about once a
Yep.
week from a chiropractor or
Yeah.
PT or
Yeah.
ATC, and that's always what they say is, "Well, how do I work with professionals?" And my answer is the same every single time.
Yeah.
You got to start with the person in front of you.
Yep.
So if
mm,
you want to treat baseball players, then you better be at every single little league,
Yep.
tournament. You better be marketing to the little leaguers,
Mhm.
because if you don't understand how to work with a little leaguer, it's really
Mhm.
hard to work with a $100 million pitcher that's in front of you.
Yep.
And so there is a very big difference. The treatment is usually about the same, but it's a big difference just mentally when it comes to those two populations. And so all you can do is just treat the people in front of you, and if your number gets called, then you got to be ready to roll.
Yeah.
yeah.
Those pros, they're very particular
Oh yeah.
Very.
about their body.
And they usually have 5 or 6 different people working on them
Yes.
too, and so it's
Yeah.
hard to get your message across.
Yes.
Yeah.
It's a tough crowd.
And I don't think pros
Yes.
like evidence-based care.
No.
They're always the ones asking you to do something really weird.
They are.
Oh yeah.
Yeah,
Yep.
they're willing
Slice
to try
straps and ring
anything.
dingers and
Yeah.
Yeah. Hey, how's
Right?
the evidence for rubbing this crystal? It's terrible. Let's do it.
Let's go.
Let's do it. I'll give you extra. Okay.
That's right. That's right.
Do you want to ask
Right.
your patented question, your main question that you like to ask people?
That was he kind
I
of
guess he kind of covered it
answered
already.
Yeah.
But
It's usually how did you get into this?
yeah.
Yeah,
Well,
well, I can go a
Okay,
little bit further if
let's
you
go.
want. And
I
Okay.
knew there was
so
more.
I was the I could use you can wind me up and I'll talk for hours. So just give me the cutoff if you need to. But
This is the easiest
so I was
podcast
a
we've ever
kid that
done.
was
Yeah.
plagued. Yeah, I was plagued with stress injuries and all these other like weird things, Osgood slaughters and Achilles tendinopathy and heel pain and back pain throughout my whole career, where I was
Mm.
playing every sport imaginable. I was wrestling, I played football, I golfed, I ran track, I did all those things, and I could never figure out what was going on. We had a chiropractor in our area who was good chiropractor, but didn't have the tools to really dive in deep and to figure things out. And it wasn't until I got to chiropractic school and I found some amazing people around me that I started to understand what happened in my own body. And a lot of it for me kind of stemmed from nutritional deficiencies. And so
Mm.
not only was I positive for celiac disease, which means I have a huge gluten sensitivity or gluten allergy, but I also have what's called hereditary hemochromatosis and some other autoimmune issues that were underlying, but were perpetuating my musculoskeletal issues. And
Mm.
so, that was one of the things that once I started to figure these things out, it was just light bulb after light bulb after light bulb. And some of those same things that I saw in myself, I see in the athletes that are in front of me. And so we're able to diagnose some crazy things. I think when Jason was there, we talked about a case of a kid that had hip pain that had idiopathic RA,
Mm.
rheumatoid arthritis. And
Mhm.
so, like little things like that, if you're really good at what you do, and it doesn't matter if you're a chiropractor, a PT, an ATC, a massage therapist, if you're paying attention and really diving into what the patient's telling you and then what you're finding in the body, you can uncover some amazing things. And then you do look like a witch doctor. Like
Right.
that was one of my nicknames, is literally the witch doctor at one of the local high schools, because I was able to get kids back on the field but also just find some crazy diagnosis and things. And not that you ever want to find them,
No.
but
Yeah.
if you can
Right.
find those in high school athletes, then my goodness, their life is so much better, because now you can make the changes necessary to live a long, healthy life. So
Yeah. What's your formula? Like, where you must have a process that you go through with these
yeah.
high school athletes.
Yeah, so my process is really rooted in assessment. And I think that this is the big missing link when it comes to no matter what practitioner we're talking about, an orthopedic surgeon, a primary care, chiropractor, PT,
Mm-hmm.
the assessment is what drives everything. And so being able to be succinct in your assessment to figure out like the two things I'm always looking for. If I'm working on a sideline and there's an
Mm-hmm.
injury, I'm always saying, okay, is this something threatening? Right?
Mm-hmm.
So meaning, is this a major ligament damage? Do they have a concussion? Do they have a broken bone? Or is this just just a little bump and bruise that we're able to kind of get them back? And
Yeah.
so if you can decipher those two things, those are two very different cascades of events that need to happen. And so my process is just that, is ruling out red flags,
Yep.
ruling out all the scary things, ruling out the bad stuff. And then if it's not any of that stuff, well, then I'm just a gambler. I'm just going to push my chips into the corner that, the assessment is clean,
Yeah.
the athlete, the patient is doing well. Then yeah, we can do some things to try to get you back on the field as long as you're safe and healthy, and then the rest is history. And so,
Mm-hmm.
one of the things I always say is, especially when I'm talking to other providers, is you never get a name in your community by resting people. Even though rest
Yeah.
is important in some
Right.
situations, but you get a name and a calling, if you will, or people
Mm-hmm.
knocking down your door if you're able to do things that other people can't. And
Mm-hmm.
so much of that is rooted in the assessment. I can't tell you how many times a kid would come to me in boots and crutches with an acute ankle sprain, and the orthopedic surgeon said, well, there's no fracture, but you're in a boot and crutches for 6 weeks. And then there's no intervention in those 6 weeks. 6 weeks comes, it's a time based, and then they're back on the field.
Yeah.
And then a couple weeks later, they tear their ACL.
Mm-hmm.
And so it's not understanding the cascade of prior injury. It's not understanding the cascade of what needs to happen in those weeks of recovery that really puts our athletes in a really dangerous situation. And so that's my cry and my credence, is to try to just get providers to understand that there's things that we can do, and parents for that matter, things that we can do within those first couple of weeks that, yes, it's speeding up the timeline, but it's also making sure that the athlete is in the best possible scenario to come back on the field safely and effectively. And I think that's my process, is just like answering those questions, and then brutal honesty. That's the other thing that I just will make my
Yeah.
claim. If you ask any of my patients, my athletes, they'll say he was very honest with me. So we learned something called informed consent when we're in school, but then when we get
Done
into
an
practice,
episode
the
on
first
that.
thing that goes out the door is informed consent.
Yeah.
Doesn't matter again where you're at.
Mhm.
And
Yeah.
informed consent means you need to present what's the diagnosis,
Yeah.
what's the possibilities, what's the downstream effects of that, what the intervention can do and it can't do, and then let the patient decide of what's next.
Right.
I've had some athletes and parents just say, "We're just not up for that." And
Yeah.
totally fine. If you
Right.
don't want to, that's
Mhm.
totally fine. Here's my suggestion. If you don't want to do any treatment, then here's what I suggest you do going forward.
Mm-hmm.
But I think that missing step of brutal honesty with your patients and with your athletes is a really important step.
Yeah. It's especially in high school athletics, the
Mhm.
parents, the coaches, the kid wants to get back so badly. And it's so
Mhm.
hard as a healthcare provider to be like, oh, you know,
Yeah.
this
Mhm.
is just not safe yet. It's
Yep.
heartbreaking
Yep.
because we all
It
want to get
is.
them back quick.
Absolutely.
Yeah.
Absolutely.
Well, and I think
Absolutely.
I think something that people should know about Taylor, excuse me, is that Taylor's had an opportunity to work with some like world-class people whenever
Mm-hmm.
it comes to the art of assessment.
Mm.
And so like there might be somebody who's listening, they're like, okay, assessment, ashmessment. Nobody says that because that's so difficult.
That's right.
Yeah, I
Yeah.
think I actually just hurt myself saying it.
Yeah.
But yeah, Taylor's had a chance to work with some world-class people whenever it comes to assessing these types of things. And so he's, you've been practicing almost 10 years, which to
Yep.
me, that's like a baby. Kathy's over 10 years, so no longer a baby. But can you tell us about like maybe where you've learned some of these assessment skills? What's been
Yeah.
most valuable to you in terms of what you use every day?
Yeah, no, that's a great question. Yeah, so I already talked to you about my biggest mentor is Brett Winchester, and so we taught courses all over the world, and then we had a podcast that was a traveling podcast, and so I got
Oh,
to
we
sit
love
down with
podcasts. We love
Yeah.
them.
yeah, exactly,
Mhm.
some of those famous orthopedic surgeons in the world, and
Mm.
hearing their stories, and other like amazing athletic trainers, and I've been in training rooms and stuff like that, and I want to tell you that, oh, if you just take this course or if you talk to this person, then you're going to be good. But honestly, a lot of it is just seeing more patients.
Yeah.
Like
Mhm.
it's hard to really realize like a dislocated shoulder. They teach you how to relocate a shoulder in school, but until you actually feel it and do it for yourself, it's
Mhm.
really hard to kind of grasp that.
Yeah.
Until you see that first acute ankle sprain, it's hard to know what to do.
Mhm.
And so I think for me, that's the biggest thing is I've watched so many amazing people, everyone from Stu McGill to Craig Liebenson to Brett Winchester to Pavel Kolaj to James Andrews, like all these
Jason
amazing
Young.
names. But
Jason Young.
yeah,
No,
Oh, yeah.
no,
Jason Young,
no,
absolutely,
not
and
really.
Kathy. But like I think that the thing that I really learned in sitting down and watching all these people is that a lot of them are doing the same thing. The thing that separates every single one of them is one, their confidence, not cockiness, confidence, but
Mhm.
then also just their undenying just presence in the room. And
Mhm.
so I think that if you can be a presence for these people, talk to them like a human being,
Mhm.
explain things at a level that they understand, then you are so much better. And then the other thing too is just continual education and paying attention to the little things, like everyone in this room, we saw patients today. And so it's very common that a chiropractor PT, they'll just go through their day of just punching widgets. Like they just, they're doing the same thing over and over
Mhm.
again. But if you take the time to really pay attention to tissue quality and what it feels like in a range of motion loss and a joint obstruction, like all these little things, if you can pay attention more, then you can catch things at a much smaller level before it becomes bigger. And so I think that that's the biggest thing that I really took away from all those people is that their assessment was very mundane, but it was very specific. And
Right.
so the more specific you can get on what you're checking for and you have a process, the better you are long term.
Right.
Sweet.
Yeah. Yeah.
So, you brought up talking about like relocating a
Mm.
shoulder, and it
Yeah.
reminded me. So, I was on the sideline for Corvallis High School
Mm.
football game. Yeah,
Mhm.
and there was an athlete who dislocated his shoulder, and the athletic trainer, she tried 3 times to
Mm.
to get
Mhm.
that sucker back in, and she looks at me, who I do not relocate shoulders.
Yes.
Like, yeah, I mean, I can adjust the shoulder, but in terms of a
Right.
dislocation, that's a different story, right?
It is.
And she's like, "Do you want to give it a try?" And I said, "No." Uh-uh. So she's like, "Okay."
Right.
So I drove the kid to the hospital,
Yeah. Yeah.
which they
Yeah.
had to sedate him and do
Yeah.
that. But yeah. So I bring that up because some of the skills that you have are not just things that they teach in chiropractic school. And so
Right.
tell us
Right.
about how you like became a high school athletic trainer,
Yeah.
and
Well,
maybe share with us. I know you've told the story before, but that moment where you worked with a kid and you were like, "Holy crap, this is what I'm doing."
yeah, no, that's a great question. So we had the contract with Troy Buchanan High School in Troy, and it's actually the sixth largest high school in Missouri. And so what that means is that we employed the ATC or the athletic trainer there. And so I had a moment, which Jason has kind of told, is that I was a little bit lost in my first 6 or 8 months in practice. I
Mhm.
was seeing everything, but nothing was really lighting me up like I thought it would. Like I was so excited to be a chiropractor and so excited to see patients, but my regular run of the mill low back pain or
Yeah.
my patient's spinal
Yeah.
stenosis or patellar tendinopathy, like they were fun, but it wasn't like, shoot you up out of bed in the morning. And
Mhm.
there was a moment where an athlete, it was their senior year, and they had just made the state championship game for basketball. She sprained her ankle at the end of the game, and she showed up to my office, and she said, I have to play in 5 days, and I have this
Mm.
acute ankle sprain. Like, what can you do? Can you help me? Right? The
Mhm.
parents, the athlete, they were staring up at me, and I remember I had like this come to Jesus moment of like, oh my gosh, I think I can. Like I actually think I
Yes.
can help you. And so I did. I said, yes, we'll see you every day this week, not knowing that they were going to be on board with it. See you every day this week. We'll do everything we can. I got this cool taping technique that I learned that we can use for you, and we'll see what happens. And I remember I woke up the next morning and my wife even remarked, she's like, "What is wrong with you? Like, are you okay?" I was like, "I am so pumped to see this female athlete." And she goes, "Well, do you have other patients on your schedule?" I said, "Yeah, but that doesn't really matter. Like at 3 o'clock, she's coming in, and I'm so excited to see her." And that was literally the turning point. So I treated her like crazy. She got out, she played, and I just remember thinking to myself, like, "Oh my gosh, like that was so fulfilling and so
Yeah.
exciting." And
Yeah.
the rest is history. And so I just started showing up at the high school where our trainer was. And early on, doesn't matter what provider you are, everybody's got a little territorial nature in them.
Mhm.
And so he was a
Mhm.
little territorial. It's like, who's this kid that smiles all the time, that's excited that's being in my training room? And so I just sat back and watched, and I just said, I'm just going to learn. I'm just going to try to be, helpful if I can,
Mhm.
but just befriend him. I just want to be a part of this. If it
Right.
sends me one patient, that'll be worth it.
Yeah.
And so I sat there and sat there and sat there. I showed up every time whenever he'd asked me to be there, or there was a game, I'd
Mhm.
be there, and I'd be there, and I'd be there. And then, down the road, he started asking me for like help on the sideline. Like,
Huh.
hey, can you check out this kid's knee?
Yeah.
I think it's this, but will you kind of tell me? And the rest is history. And I started doing it more and more. And then 2 other high schools contacted me and asked me if I could do similar things. And so, at its peak, I was working with 3 local high schools, everything from, the 7th largest school in Missouri to literally one of the bottom 5 smallest high schools in
Huh.
Missouri. And I tell the story, when I would go there, they didn't have anything. They didn't have a trainer. They didn't have anybody that called on their school. And so I remember the first time I showed up and I had a line of like 50 kids. And then the janitor was in the back of the line, and the principal and the kindergarten teacher.
Yeah.
And, I was like, oh my gosh. But it taught me a really, really important lesson, because I was only there for 2 hours. And I had to go through that many patients.
Mm.
But it taught me how important how good you can get with
Mhm.
your assessment very quickly.
Yeah.
And so you can come to a conclusion, even though it might not be 100% right, but you can at least start the track down. And
Right.
then what I would do is I would just, on my way home, I would call every parent. And I would say, hey, I saw Timmy today. I'm a chiropractor. This is what I do. I saw Timmy today.
They're
This is
like,
what I think is
oh,
going on.
chiropractor.
Yeah, exactly.
Not
I
a
was like,
real
this is what I think is
doctor.
going on. This is the therapy that I would suggest for him. I do this therapy in Troy. Here's my office. I'd love to treat him if you're interested. But otherwise, if you want any more information, or if I can help in any way, here's my cell number, and the rest is history. And surely but surely, or shortly, they just started showing up on my schedule. I was like, holy crap! Like
Yes.
this is kind of cool. And then the thing that we always talk about with trainers, it doesn't matter if you're with a big team. Like,
Mhm.
sometimes you just don't have enough reps. If you only have 20
Mhm.
guys on your team, like, it's hard to get enough reps to see things over
Mhm.
and over again. And so I was seeing things from 3 different high schools. Therefore, I had seen that 2 or 3 times. Like, I know what that is. Like, I can help with that. Like, no, don't. Like, I appreciate what you're saying, but I think you're off a little bit there. And so then it just got me better and better with confrontation of the athlete, the parent, the coach, the athletic director, and the rest is history. And so then my skills just started developing, because I kept paying attention and I kept showing up, and just more and more reps.
So, if somebody's interested in doing what you've done,
Mhm.
like, what's some advice that you might give in terms of that communication piece? Because I know that in the sports medicine stuff that I've done, that's been the key thing, is understanding where I fit on the team and what I bring
Mhm.
to
Yep.
it, and
Yep.
like not overlapping on work and stuff like that. Like, what's
Yeah.
advice that you might give to somebody on that communication and collaboration piece?
No, it's huge. It's a great question, Jason. And usually when someone says great questions, it's because they're buying time to get their
Yeah.
answer right, right?
Yeah, and then
But no, it is
usually
a good
when somebody
question.
points that out, they're trying to buy themselves some extra time. If you wanna go get on the assault bike back there, you
Yeah,
can
right
for a little
behind
bit.
me, right
Yeah,
there.
just
No, no, I
just
speak.
come back to us after a few minutes.
My advice is get good with confrontation.
Okay,
Like,
Mm.
okay.
not only that, like, get good with confrontation, because there's going to be a point, like, with your patients, like, you have to
Mhm.
have some
Oh, I'm
confrontation,
always
not in a mean way,
confronting
but
them.
just
"Look,
yeah,
look,
yeah,
look at your
yeah.
spine.
Why have you done
Look.
your exercises?
Look.
Why have you
What?"
done this? Yeah,
Yeah.
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 Just look at you.
But also just knowing your role and knowing your skills, I think, is a really
Mhm,
important thing. Like,
Mhm.
early on, I did not have the skills to be in those situations, and so a lot of times I did step back. It's like,
yeah,
Mhm.
dang, I wish I knew what to do at that point. And then
Mhm.
that's what drove me to find more education and to ask questions and to reach out to people that have seen those things before. And like, it's just that constant pursuit of education and
Right.
learning that is what drives you to be better. And so that's my suggestion, is
yeah.
just expose yourself to uncomfortable and maybe even scary situations.
Mhm,
That way, the more you see it, the less scary it is.
Very.
It's just like showing up to a networking event for the first time. Like, that first
Yeah.
time, you got a little anxiety, you got some
Terrible.
jitters, you're like, all those different things. But the more you do it, the more easier it is. It's just like a muscle. The more you work it out, the better it is. And so I think knowing your skills and being very
mhm,
comfortable and where you're at, like,
yeah,
where do I fit? What am I really, really good at? If it's manipulation or adjusting, that's great. Like, kids that have low back issues or things like that, like, that's a great kind of niche that you can build within that sports medicine practice. If you're not good with shoulders, be honest about it. Tell that trainer, hey
yeah,
man, that's just not my thing. Here's
Yeah,
a better
be like,
provider that
do you
can
have
help
like
you.
a hip or something that I can? You have a
Exactly,
hip, or
exactly.
maybe like your mid back is kind of
Yeah.
sore, not your
Yeah,
shoulder.
Yeah.
yeah.
Yeah,
Knees are
But
my jam.
also,
yeah,
but also I think it's important to know those limitations, and then if you want to be in that world, you got to know it. And so you
hmm
find more education, find more places that you can learn or be exposed to those things, and just be honest with yourself, number one, and then number two, be honest with the world about where your limitations are, and people will be more than happy to help you. So
What was what's one of your favorite places where you found more education?
it's a
Content
good
stuff.
question,
Yeah.
man. I am a
Oh,
seminar
there he goes. He
junkie,
did it
so
again.
He did it.
Oh, that's a
Oh,
Can you
Kathy.
repeat the question? No.
yeah, right. I did what you probably shouldn't do, and I just took everything under the sun. I
Yeah.
mean, I've been
Yeah.
to everything you can imagine, but kind of the lens that I look through movement is called DNS, dynamic neuromuscular stabilization, out of the
Mm.
Prague school. So that to me is the way that I kind of look at all movement. And then McKinsey Institute, or
Mm.
MDT, is a really, really high level for me. And
Mhm.
then as far as like sports medicine stuff, you can actually go to these like big orthopedic hospitals, everything from like the Mayo Clinic to out east, and they do free online trainings all the time. And so it's mainly surgeons in there, but the
Mm.
surgeons talking about their technique, it's talking about the assessment. And so you can buy a lot of things from them, and kind of gain some knowledge there.
Mm.
And then also, if you have a good orthopedic surgeon in your area, find the PA. The surgeon's usually too
Yes.
busy,
Yeah.
Yeah,
buying more yachts,
Yes.
or
yeah,
hopping in
yeah.
their sports car, but the
Tuning up their
PAs
Lambo.
are
Yes.
exactly. But
Yeah.
the physician's assistants are the
Yes.
ones that do most of the sideline care and the diagnosis specific.
Yeah.
And I've learned so much from the PAs in our
Yes.
area about what that all looks like. So that would be where I would go. I would
Yeah.
find the athletic trainers that have been doing it for a
Mhm.
while, find the PAs that are doing really good. And if anybody has specific questions, they're more than welcome to reach out to me about that. So
Yeah. Yeah.
So maybe we could focus a little bit on, let's pretend that people listen to this podcast, and let's pretend that some of those people are like high school athletes or parents of high school
Mhm.
athletes. Um, like this is your chance to maybe kind of give them some wisdom. Like what's going to
yeah.
help an athlete to perform better, to be
Mhm.
able to play all 4 years, which I've got,
Mm.
a couple high
Mhm.
school athletes, and I'm learning that like you don't always get a full season
You
because,
don't.
injuries happen.
Mhm.
Yeah.
Like what are the most important things for these kids and their parents to understand about being a high school athlete?
So Kathy and I were actually talking about this before we pressed record, and I think the
Mhm.
number one thing that I've learned is nutritional status. So my experience just for my own body, like I had some massive nutritional
Yeah, there's
deficiencies
a
and
lot of
some
teenagers
underlying
that are just
autoimmune.
like, "Oh, I turned this off."
Yes,
Oh,
exactly,
oh,
and
I
it
gotta
is,
eat better?
it
Oh,
is.
the only thing that would have been worse was if you would have told me to go to bed on
Put my
time.
phone
Well, and
away.
that's the next thing I'm gonna break down that confrontation, Jason. We're gonna
Yeah,
punch down the wall.
there
It
we
is.
go.
So, I mean, the more you look at sleep, so I have a study every time I sleep in that one night of uninterrupted or interrupted sleep, meaning
Mhm.
you sleep for less than 8 hours and maybe you don't get enough REM or deep sleep, it reduces, they looked at males specifically, it reduces testosterone production by like 34%.
Oh,
Whoa.
And
snap.
so, what that means
Uh-oh.
for a high school athlete is that when you're in your formative years and
Mm.
testosterone is coursing through your veins, that's part of the substrates that helps heal your body,
Mhm.
right? It shuttles collagen to your tendons, into your ligaments, into your muscles, and it allows you to literally grow. But if we're losing sleep or we're not getting good enough sleep, then you're behind the eight ball already. There's no chance that your body can rebuild itself at night or during your recovery periods because you haven't given it the right fuel to do it.
Yes, I
And
need
so I
my
think
sons to
that
rewind this part and listen to that again. Okay.
it
Sleep.
is.
Alston and
It
Griffin,
is.
who I was told that I never say Alston's name on this podcast. I talk about Griffin all the time,
Yeah.
but Alston, I always call him my older son.
Yes.
But
My
yes,
No,
old son.
Alston. His name's Alston. Alston Young. Anyway,
at least they're
rewind that,
walking.
listen
That's
to it,
huge.
boys. Yeah. Okay. Yeah. Good.
But
Okay.
then
So sorry to
nutritional
interrupt.
status is, yeah, nutritional status is the other big piece. And so one of the things when I started at Troy that we had horrible cramps in football. I mean,
Mm.
Mm.
horrible cramps. Nothing will take an athlete out of a game quicker than a
Mhm.
cramp. Like
Well, and you
it's
can
so
tell when they
hard to
get them.
recover.
It like
Yeah,
I can spot a cramp so easily. And they look horrible. Parents are like, "Oh my gosh, what's wrong with it? Oh, he's got a cramp." No,
Mhm.
that looks so gross. What's happening? Yeah, he's got a cramp. So,
It's cramp.
Yeah,
yeah.
and really that comes down to a couple different things. Like if you're just smashing high, like dense carbohydrates the
Mm,
entire day, it's so hard for your body to have enough fuel to shuttle the water to your tissues.
mhm.
And so what I did is I instituted like we bought them a ton of really good electrolytes. So sorry, no Gatorade or Powerade,
Oh.
low sugar. We
Electrolytes.
implemented like
That's what plants crave,
Mhm.
right?
that's right. Yeah, that's right.
Did you
That's
catch the
exactly right.
reference?
So that's exactly yes.
Idiocracy.
So yes. And
Gatorade.
then
All right.
I would carry around a bottle of like really good sea salt. And when they
Mm-hmm.
weren't looking
Oh.
on game days, I would dump a bunch of it into the water bottles.
Oh.
Oh.
And the
Splash,
kids
splash.
always were like, "Oh, this water tastes crappy." I'm like, "Just drink it. I'm telling you." But then also just getting on a good magnesium supplement
Mm.
because magnesium. I always say if magnesium was a prescription drug, it'd be the number one prescribed drug on planet Earth
Mm.
because it helps with everything. Helps with sleep. Helps with muscle cramps. Helps with recovery. All these other things. And so like those are very small things that we did without really attacking the nutritional deficiencies. But it's a pretty good indicator that if you're eating fast food a couple times a week,
Mm.
then you're going to have issues on the field. Like that's just the reality. And then the other thing we did is it's really cool. But the team for football specifically before games, the parents would cook them this awesome meal beforehand,
Mhm.
and we've all been told to carbo load
Yeah.
before, right?
Yeah.
No.
Well, the biggest myth I can tell you about carbo loading is that if you're carbo loading with very complex carbohydrates, pasta, high
Mhm.
that's in inflammatory foods like gluten and dairy and soy, then it's so hard for your body to not only digest
Mm.
that, so it's requiring so many more, electrolytes and proteins and things like that to break that tissue down. It's so hard for them to get through the game without having issues. And so, to me, it's nutritional status is the number one thing. So that's the biggest thing. And then just looking for warning signs. For me, and it sounds ridiculous, but it is very, very common. A loss of range of motion is one of the biggest predictors of injuries that I can tell you about.
Hmm.
Whether we're talking about growth plate
Yeah.
injuries, whether we're talking about massive ligament damage, things like that. So check, like having someone that's looking at your athlete, especially if you're wanting them to play year-round sports, which we talk about, which now youth sports is the fastest growing industry in the world. It's like a multi-billion-dollar industry here in
Mm.
the United States. So if you're spending fives, tens, thousands of dollars on your kid's travel team,
Mhm.
you have to invest on someone checking up on them. Whoever that is, I don't care, but they should be doing a really good job of looking at their tissues, looking at their joints. Are they moving properly?
Yeah.
All these things matter when it comes to putting them out, especially when it's game 7 of a weekend tournament that your
Yeah.
kid has been practicing for 5 days and then played 7 games. So like it's not a matter of if it's going to break down, it's a matter of when.
Yeah.
So
Mhm.
the other thing too is I always say like I always deal with the double D's, and I'll bleep myself, but dumb dads,
Yeah.
right? Dumb blank dads.
Yeah.
And the
Yeah.
reason I say that is because so many times we're living through our kids'
Yeah.
athletic career. There's another good
Oh,
study.
you're
I
talking
can't remember
about
the
me?
author, but
I'm
Yeah.
sorry.
yes, exactly.
I heard you say living through your kid's athletic career, and I was like, oh, that's me.
That would be
Yeah.
you.
Uh-huh.
Yeah,
Right.
right.
That's
But
what my
they looked
therapist
at
said.
yeah, that's right. They looked at little league baseball players, and all they did was they tracked how many throws a kid had on a weekend tournament. And so it's very common that in a weekend tournament they have these stipulations
Mm.
on the amount of pitches you throw. So you may get 100 pitches for the entire weekend. But my thing that I always do is I just on my whiteboard I just write up, okay, so your kid shows up to the ballpark for a weekend tournament on Friday. What's the first thing they do? Well, they play catch to warm up. Perfect. How many throws do you think they threw? I don't know, 30 or 40. Boom.
Mm.
So I'll put 30. Okay. Then they're going to pitch that first 5 innings. Okay. How many pitches they throw? Well, they threw, 75 pitches. All right. Well, there's 75. Then what happens after they get pulled from a pitcher? Oh, well, they go play outfield because they have a great arm. Perfect. How many times do they throw the ball between innings and during the game? Well, there's another 40.
Mm.
Okay, well, you're over 100 throws before you even get past the first game, and then you're going
Mhm.
to do that 5 more times. Do
Yeah.
you think that that's a sustainable thing for your kid to do when its growth plates are still open? It
Yeah.
hasn't adapted to the tissue demand. Oh, by the way, you're feeding it chicken nuggets between games.
Yeah.
Like these are all recipes for disaster. Like this is
Yeah.
this is the intervention that
Mhm.
you have to have with these
Mhm.
parents because they're investing a ton of money and time into
Right.
it, and I get that. And the last thing you want is to not play that tournament that you paid for. However, you're going to spend way more money with me if you are doing this. So like,
Right.
invest a little bit of time. Let's be smart about the programming, smart about that kind of thing. And then hopefully we'll be able to be a little bit safer.
Mm-hmm.
Awesome.
So I've talked about this before, but I help coach the girls basketball team here at Corvallis High School.
Go Sparts.
Let's go Sparts. And I've always thought about this with high school athletes. We ask them to do so much now, and they play year round, and we don't prepare their bodies for it. My bias obviously is strength training, and I think the other missing piece obviously is nutrition. And we had actually our good friend Stacy Kazinchuk come and talk to the girls' high school team. She's a RDN. Registered dietitian, nutritionist.
She's a veteran of the Pitch podcast.
Yes, a veteran of it. So she came talk to the girls, and I know that Coach Miller is gonna we're gonna be talking about nutrition throughout the season, and I think this brings up a really good idea that we need to have a team meeting with the parents.
Yeah.
And talk to them about that. That's the key, right?
Well, and I think that parents don't get it sometimes too, because they're like, well, first of all, you get, when you're going back to your DDs, right? Your dads who remember, well, in the 80s, this is how we did it. I had Dr. Pepper and I was trying to get all my calories in. And one of the things that you brought up, you talked about like carb loading and fast food and things like that. And, fast food is okay. The big problem with it is that it's not nutrient dense. And so you can go through a drive-through and you can get foods that are nutrient dense. Like go to Chick-fil-A, which I'm so happy we have one now. You can get that crunchy kale salad, and that's full of full of nutrients,
all the
right?
good stuff.
Or the grilled nuggets.
Yes.
Yeah. Ooh, the grilled nuggets.
The waffle fries, not so much, right?
Oh, but hey.
And so sometimes when and part of the problem is, no offense, because you're a coach, but part of the problem is that it's coaches that are giving the education on what to do. And a lot of it is based off of what their gym teacher told them in the 80s.
In the 80s,
Yes. And so we know how destructive the 80s were. No, I'm just kidding. The 80s were
Look at
awesome.
us.
Yeah, the 80s were. And so that, I think that you're both right in that I think one of the great things about high school sports is it isn't just a responsibility, it's an opportunity, because what you do with a high school athlete can set the tone for literally the rest of their life.
Yes.
And as we just discussed, whenever they start coaching kids, maybe give them some good advice.
They have good advice.
Eat a carrot.
Do you have
it brings up a good point too, Kathy. Sorry to interrupt, but the strength training component. And the thing I see is that, there's some amazing studies. Like Tim Hewitt is one of the best ACL researchers. And he talks about the difference between male and female. And for me, people talk about, well, we don't give enough resources to the female strength training stuff, which I 100% agree with. But a lot of times we're trying to match what we do with male strength training or male performance training to what females do. And the reality is that their bodies are very different.
You're speaking my language.
Different stages. Yeah, different stages of puberty at different times. They have different hormones coursing through their body. They are a completely different organism in my eyes, right? So in turn, like we've got to have different standards when it comes to strength training for females and males. It's just the reality. And so one of my really good friends, Jake Alec, is in Chicagoland, and they're in a very affluent school district. And so they actually pay him to program for all the teams in the school district.
Wow.
And so him and I have had some amazing conversations about what it looks like, differences between, females versus males when it comes to programming. And a lot of the times he's not putting barbells on these girls' backs. He's using dumbbells. And because the reality is that you can't fit a square peg into a round hole. Like that's just the reality. And so for me, it's difficult to get the weights correct. Number one, you're relying on the coach to pick those, or the athlete that has no idea about what their body feels like. Or two, you're asking them to do these huge compound movements that are more destructive than anything. And so that is a huge concern of mine. That's why you were joking about my tonal.
Your tonal.
That's why I love my tonal. The reason I love my tonal is it goes up by 1 pound. So you can change the weight 1 pound at a time. And so the thing I say all the time is like, how many times you go to the gym, you ground a 15-pound dumbbell and it's too light, but you grab a 20-pound dumbbell and it's too heavy.
Yeah.
Well, that is very, very apparent the lower the weight is.
Yeah, muscles only work in increments of 5.
I know.
That's it.
Right?
Yeah.
So And in reality, like it's just there's this giant disconnection between strength training and our populations of people that we're trying to use it for. So this is a big concern. And then, I mean, if we really want to get crazy, I have a huge functional medicine background, and that's usually what I spend most of my time doing now. Female hormones are a big
Mhm.
topic of conversation, and so
Mhm.
like they've even looked at it. Depending on where
Yeah.
your athlete's at in their cycle, they're more likely to tear their ACL.
Yes.
That's a hallmark study.
Yes.
So now you have people that are saying, well, why don't we just use hormone suppressants with our female
Oh my
athletes in an
gosh.
attempt to protect them against ACL
No.
tears, which is absolutely,
No.
I mean, that is insanity.
Oh,
Like insanity, but it is coming. You just
Yeah.
watch. Like
yeah.
the number one of the most
Dear
prescribed
Lord.
drugs when it comes
No.
to 12 to 18-year-old females is birth control.
Yeah.
Birth control has all sorts of issues
Yeah.
downstream that
Right.
we don't have to get into right now.
Right.
But if that's a consideration, or your doctor or your PT, your coach, whoever your chiro is suggesting, you need to run away.
Yes.
Like there are so many other things we can do
Mhm.
protectively rather than give our
Mhm.
girls hormone suppressants that is going to mess up their chances of fertility long term.
Yep.
So that's my soapbox.
Yeah. Wow. Okay. One last question. Uh,
No,
uh,
we're good. Yeah.
okay. Okay. How do we talk to the high school athletes, female, and get them to eat?
Mhm.
Because the stigma is,
Yeah.
Oh,
we beg them as coaches,
yeah.
please
Yeah.
eat.
We got to use slogans like strong is the new skinny.
Yes.
Yeah.
How do we get them
It's
to
the
eat
slogans.
more calories?
You brought up the biggest. I cannot tell you how important that is. We live in a society that
Mhm.
perpetuates not eating, basically.
Yes.
Yeah.
Yeah.
And really, it starts at home. Like
Mhm.
the parents are busy people; they don't have time to cook. Therefore, you're eating out.
Yeah.
2 meals a day,
Mhm.
and then that gets carried down. Like everybody says, oh, my genetics are bad. Well, no, your genetics are your habits and your
Yeah.
family's
Mm,
habits.
yes.
So if your family has crappy habits, you're going to have those same habits.
Totally.
So you've got to break the criteria there. And how I do that, to answer your question
Yeah.
directly, Kathy, is to educate them on how your body works.
Mhm.
So how many times have I been told that I have a good metabolism because I'm skinny? Well, that's true. I was
Yeah.
blessed with that. However, our metabolism works by the more fuel you give it, the
Mhm.
faster it burns.
Mhm.
So you're burning, let's just say on an average person, let's just say myself, just to keep my brain functioning, I need 16 to 1700 calories a day. And that's not, we won't even talk about what those calories are made of, but that's just to make sure that my brain can still function. So then you're burning some upwards, if we take a high school athlete, up to 3,000 calories a day. So if you think by only eating, 1,000 or 1,500 calories in a day, then you're going to get skinnier, that's completely off. Your body's going to have an absolute fight or flight response to it. It's going to slow down your metabolism. It's going to slow down your recovery of the muscles, joints, ligaments, tendons. Therefore, you're higher risk for injury. Versus if you actually fed your body the fuel it needed, you're not going to gain weight. In fact, you're actually going to put on muscle, which is amazing. And I promise all the female athletes that are listening, you're not going to get bulky.
You're not.
Nobody gets bulky by that. Is the craziest thing everybody says. Well, I don't want to lift weights because I don't want to get bulky.
I mean, there's enough teenage boys out there that aren't getting bulky, right? And so, well, and so I think to put in context what you just said, because I think it's really important, is the thing that you said that's really important is habits. Because people talk about calories in, calories out, and usually when we talk about it in the context of a day, right? I'm eating 3,000 calories today. I'm burning this many calories that day. One day does not matter.
No.
It doesn't, because you don't have a day where you've exercised. Well, some people do. It's like if you do a marathon, idiots. Now, if you do a marathon, like you'll lose like 7, 8, 9 pounds in a day, right? But most people aren't having that. Most people are having normal days. And so your calories in, calories out is the accumulation of, think of, if you're going to do calories in, calories out, do it over a month, right?
Yeah.
Or a couple months, because that's what's actually going to move the needle in terms of your goals. I think that where some of the dysfunction comes from is people start micromanaging this, and they're thinking about, oh, this one little meal, or, this day, what did I do? And, oh, shoot, I need to go for a run today because, I didn't. And that is like the recipe for neurosis.
Right.
And so looking at these things more from a habit standpoint, because You get to who you are and where you are over an accumulation of days, not over like a few hours.
Mhm.
It's a
Otherwise,
good point. It's a good
otherwise I
point
would be
too when it comes to
amazing.
just
I would be.
yeah,
I just
it comes to a good
lifted
point with
weights. I'm amazing.
it comes to the same point with load. Like if we
Mhm.
just look about load, and I don't necessarily mean like how much weight you put on your back, but just
Right.
load in general.
Yeah.
So, if your kid's practicing 6 days a week and you have 1 day of recovery, but that day of recovery they're out playing, going crazy,
Yeah.
Yeah.
and they eat like crap, like your accumulation of your days equal your weeks, equal your months, equals your years. And
Mhm.
so the overall, load is just like calories in, calories out. And so that's why I have the same thing. I have the parents. Let's just take a bird's eye view and just look at everything. Just rate your kids' nutritional, just habits on a scale 1 to 10. Oh, they're like a 3. We go to, we eat out all the time. Okay. And then what about their overall load in a week, right, in a month? Like how much are they actually doing? Well, they're doing a lot. They're doing a lot. I said, okay, so you're at a 10 and a 3. So like, do you see the difference here?
Mhm.
So like you
Hmm.
can keep
7. Did I get it right?
you
You got
Is
it.
that right? It was
Yes.
yeah,
7.
there you go.
Okay.
So, but you can keep that load up. We can
Mhm.
keep them involved, but now this has got to bridge the gap. Like these
Yeah.
have to get close
Yeah.
to each other in order for your kid to not get hurt, or you end up in my office more and more and
Sure.
more. So, yeah.
Totally.
Yep.
Man, that's so good. I got one quick question, and
Yeah.
then we have to play a game
Yeah.
because I know that's
Yeah,
the real reason you came was to play the game.
that's right.
So for a parent, because I know I'm having this conversation with one of my sons. Uh, what are parents supposed to look for to identify signs that a kid is maybe doing too much, right? They're burned out, they're overtraining. Sometimes, sometimes they're doing it because they really love the sport and they want to keep playing. They just want to do it the most. Other times, it's social pressure to do too much or whatever type of pressure. What are the things that parents can be looking for so that you can intervene for your child and help them to dial it back so that they could have a really long, healthy life of physical activity?
Yeah, so for me, it would be a couple things. I already said having someone check in with your kids is
Mhm.
is amazing. Someone outside of that, I would say if they're asking you for some sort of NSAID, that's a red flag.
Okay.
Like, hey, I have a game tonight, but I need some ibuprofen. Well,
Mm,
let's slow down. Okay, we know that NSAIDs weaken tendons and
Mhm.
ligaments. All
Mhm.
right, so that'd be a good indicator. Uh, that would be huge. The other thing would be if their excitement to go is just dwindling, then
mm,
that's when questions should arise.
Mm.
I remember I was so pumped to go to practice and to go to games and stuff like that. But then I hit a point in football where I started to get a little bit burnt out. And so
Mm.
I had some great parents. They just asked me, do you want to keep doing this? And the answer was yes. But I think it's just important to have those conversations. Like
have the
that's
check-in.
a healthy way to, yeah, to structure your family is to have difficult conversations. Like,
Mhm.
hey, do you still love doing this? Like I know we've invested a lot of money in this and things like that and time, but at any point, like we can pull the string. Like we want you to be healthy and happy. And I think that's difficult because a lot of times, again, we are spending thousands and thousands of dollars on our kids when it comes to athletics, but you got to get that out of it and think
Yeah.
about the kid as a human being. So that would be number two. And then number three, I think it would just be um, just listen to the way they talk. Like are they falling asleep at the dinner table? Are their grades slipping? Like all of these little
Mm.
things mount up into one kind of issue. And so the other thing that is really, really common now is kids struggling with anxiety. Like
Mhm.
I cannot tell you how many kids are being prescribed antidepressants and anti-anxiety medications, and getting to the root cause of that, I think, is a really important thing. So if your kid is not getting excited to go to events,
Mhm.
not getting excited to go to sporting events, or they're overzealous and maybe they're asking you for ibuprofen, or
Mhm.
they're asking you to ice their knees at night,
Mm.
or
Mhm.
little things like that is always just can raise the question of, hey, maybe we need to get this checked out. And I think what's the old saying, like an ounce of prevention is worth everything.
Mhm.
So the more that you can just have check-ins mentally, physically, emotionally with these athletes, the better idea you're going to have is whether or not they're getting to that burnout phase, or they're getting to that kind of stretch where injury is not necessarily happening, but it's imminent. And so I think that would be a good little framework for everybody.
Love it. Man,
Great.
such good advice.
Yeah.
All right, I guess now I got to have conversations with my kids.
Yep.
Dang.
Sorry.
Yeah. I know it's hard. It is hard. And a lot of times, I can't tell you how many times parents would text me and like, hey, we're coming in today. I think this is an issue. Can you talk to them about this? And it's like,
Well, and it's
Oh,
different. It's
great.
different when it's not coming from mom and
Yep.
dad.
Yep.
Yeah,
it
and
is.
it's tough for me because sometimes, geez, it's so frustrating. Like the kids will be like, they go to my wife and they're like, "Man, mom, my shoulder really hurts." She's like, "You know who your dad is?" Like, yeah. Oh, that's a good point. They just don't even freaking think about
No.
it, right? They're like, "Oh,
Right.
okay."
That clown?
Yeah, and then sometimes it's like, when is my dad talking to me as a healthcare provider?
Yes.
And when is he just talking to me as
Mhm.
dad?
All I
So,
hear is
yeah.
blah, blah,
And
blah.
that's
Yeah.
where, honestly,
Yeah.
Jason, with that, I can't tell you how many other chiropractors and
Mhm.
health professionals in my community would bring their kids to me
Yeah.
for that reason.
Yeah.
You
Yeah.
know, and so I think that's another
I'm
important thing.
putting my
Like,
boys on a plane.
Yeah.
We're gonna be there
yeah,
next week.
Headed
Yeah.
to Lincoln.
we'll do Zooms. We'll do Zooms. It'll be
Yeah,
fine.
yeah,
But I think
exactly.
that's where your network really comes in. And I
Yeah.
think, the last thing I didn't say would be to find a trusted provider.
Yeah.
Mhm.
It doesn't matter their credentials.
Right.
If you've, seen people in your area that have had good success
Mhm.
and is a straight shooter,
Mhm.
trust them. And the other thing too is like, it's a good provider if they're willing to get second opinions.
Mhm.
Yeah.
I can't tell you
Yeah.
how many
Yeah.
times I would take x-rays, MRIs, findings, and I would send them to the PAs, or I would send them to the radiologist, or I would ask my colleagues about them, and I would tell the patients I'm doing that. I would just literally, again, brutal honesty, like, hey, I think this is what's going on, but I have a little bit of doubt. Do you mind if I consult with another provider just
Sure.
to get a second opinion? And every single time they're like, oh my gosh, you can do that? Like, we're so used to healthcare where everybody's in their little box and nobody talks to everybody.
Right.
And to finally have someone that's willing to have conversations outside of it, boom. And then that way I never have people go outside of me. Like, the worst thing you could do as a provider is have someone, you set up a plan, and then the next thing you know, they're with some other provider who's doing something completely different. And that may be a good plan too, but consistency is important. It really is. And so, if you can find someone that you trust, then trust them and listen to what they're saying.
Bingo. Love it.
Mhm.
All right. You ready for a game, sir?
Can't wait.
Okay. Well, we'll see how you do here. This brings us back to our very first episode, I think.
Yeah.
No, was it our very first? Yeah, because Kathy pulled this one on me.
Oh, yeah, yeah,
and
yeah.
it stung ever since. Like,
Oh,
I'm still haunted
you
by
were
the
weren't
level of
ready for this.
Now I'm
decision
nervous.
making I have to make. Okay. This is a classic game of start, bench, cut. All right. So we're going to give you 3 options. You have to start one, bench one, and you have to cut one. Okay. Does that make
Got it.
sense? Yeah.
Yep.
So
Yep.
start. Okay. Good. All right. Cool. All right. Recovery tools: ice bath, massage gun, foam roller.
So ice, massage gun, and foam roller.
Yep.
Ooh, this is tough.
I
We're
already
talking
know.
ice baths, correct? Not
Yes.
ice on the skin?
Ice
'Cause I
bath.
hate ice on the skin.
Yeah, I knew that
That
you
way.
would cut that
Mhm.
one.
Uh-huh.
So, but we're talking ice
I'm gonna
bath.
say, yeah, I'm gonna say ice bath. I'm gonna start. I'm going to I'm gonna cut the massage gun and I'm gonna bench the foam roller.
Okay. All right. Very good.
Okay.
The reason
Okay.
I like ice baths is that there is systemic inflammatory
Mhm.
decreases with that, and it also builds resilience within our mind. So I love ice baths personally.
Yeah.
I hate it for acute injuries, but I do like it.
Yeah, I
The
gotta
reason
get it into like I call it Viking mode. If I'm gonna take like
yes,
a ice bath or a cold shower, it's like
Woof.
I gotta dig into my deep Scandinavian roots and
that's
just
right.
like,
That's right.
yeah, because look at me,
Look at
I'm
you.
Thor. Yeah.
Straight from
The reason I
straight from
The
Scandinavia.
reason I cut massage guns
Uh-huh.
is they can be an unbelievable tool, but I see people overuse
Yeah.
them every day.
Yeah.
Why,
And
the
that
bruises?
produces
Come on.
yeah. Oh my gosh. And so it's just like anything. A tool is really good. Like if you put a hammer in a
Mhm.
carpenter's hand, it's
Yeah.
unbelievable. You put a hammer in my hand, I'm putting
Mhm.
holes in things.
Yeah.
So,
Yeah.
like the tool's only as good as the beholder.
Hey,
And so the
hammer
foam
could be
roller
a
to
murder
me is
weapon.
Yes.
that's right. That's right. The foam roller to me is a little bit less. You can do less harm, and if it's used correctly, like I love it for joint mobilization and
Mhm.
spine mobilization and stuff like that. So that's
Love
why I
it.
do that.
Okay, sideline snacks. We got orange
Okay.
slices, goldfish, or Uncrustables?
Mm.
Oh. All right. Well, I'm definitely starting orange slices.
Okay.
Um. Oh, this hurts my soul to have to pick here.
Mm.
I would cut both of them, to be honest with you.
Oh,
Uh,
what? Wow.
Uncrustables?
Yes, the
Really?
reason Uncrustables, we say that peanut butter is a good source of protein,
Yeah.
and that is just an absolute false.
What?
So proteins come from legumes. Majority of people have some sort of sensitivity to peanuts, and it's a mess. Plus the wheat around it. But I would pick Uncrustables, so I'll bench Uncrustables, and then I'm going to cut the goldfish.
Okay.
Goldfish has basically no
Yeah,
nutritional
no.
benefits. So
But
there's
I love
nothing
the
there.
fishes because they're so delicious.
They are delicious.
That's right. Hey, one of the things on that with wheat, you are probably seeing, especially as providers, that there is like an epidemic of kids with loose connective tissue.
Mm.
I don't know if you guys are seeing that.
Mhm.
If you're not, you're going to start. And I don't know what the reason specifically is, but there's actually some pretty good correlations between people with Ehlers-Danlos, which is like
Yep.
the end
Yep.
perspective of loose
Yep.
connective tissue, and celiac disease
Hmm.
or gluten allergies.
Well, dang it.
So there's not a good. I don't know what the reason is, but
Mhm.
that is. So I saw it so much in the high school athletes. I saw a lot of them had loose connective tissue,
Mhm.
and if we test them for celiac disease with a blood serum, you will find celiac disease in like 40% of them, I would say.
Huh.
Wow.
And so that's why I don't like those snacks.
Got
The
it.
the orange
Okay.
slices, there's not going to have like an allergic reaction, or you're not going to have any like underlying inflammatory response.
I have a response to orange slices because when my kids were playing AYSO soccer, they used to make us like cut up like a
Mm.
gallon or 2
Mm.
gallons of orange slices. So I get
Brutal.
PTSD. All right.
Brutal.
How about this one? Baseball legends. Ready? Ken
Oh,
Griffey
boy.
Jr., Shohei Ohtani, Barry Bonds.
Pre or post steroids for Bonds?
Oh,
Uh,
zing.
that's
I'm
kind of
just
giving your
joking.
answer, isn't it? I don't know.
Um,
Post steroid Barry Bonds was pretty dope. I mean, that guy was hitting home
He
runs
was-
all the time.
Hey, I'm in
Big
favor
head.
of a league that's all steroids, because I think that'd be made for TV. I mean, that'd be
Well,
unbelievable.
and you know, it's the thing is, you
As long as
got
everybody's
so
on
many
them.
guys that are juicing
Yeah.
anyway, and it's not all that there is to hitting a home run.
No, there's
Like, look at the guys.
Yeah, he was still a good hitter before he went on steroids.
Absolutely,
Yes.
absolutely. Okay, but Ken Griffey Jr., Shohei
I'm
Ohtani,
gonna-
Barry Bonds.
I'm going to start Ohtani.
Mm.
Okay,
I think what he did this year in the playoffs,
Mm.
it was the best game ever played. He
Yeah.
threw 6 unhittable, and then he hit 3 home runs. That's
Mhm.
nobody will ever do that again.
No.
That's pretty
He's
good.
the modern day. He's the modern day Babe Ruth.
Yeah.
I agree. That's
and
all
then
right.
I'm
That's
gonna
pretty
go-
good.
Yeah, and then I'm a weird baseball guy. I love defense, and so Ken
Uh-huh.
Griffey says he was the best hitter ever, but he was unbelievable in the field.
Mhm.
So
Mhm.
I'll bench Ken Griffey, and then I'll cut Barry Bonds. So.
Yep.
Okay,
Even though I think Barry Bonds should still be in the Hall of Fame, but that's
Wow.
I agree with you. I agree with you.
Wow.
We don't know how many of those guys who are in the Hall of Fame were cheating.
This is
Oh,
true.
So that's the thing.
absolutely.
If they're good, they probably were cheating. So, all right, I'm going to give you 2 more, okay? And then
Bring These are fun, actually. I like.
yeah, so we're going to do youth athlete bad habits.
Mm.
No warm up, no sleep, or pre-workout at 7 a.m.
Oh, you got to start one of those?
Yeah. Actually, you know what? We're going to switch out the pre-workout at 7 a.m. We're going to say chicken nuggets.
Nuggies.
Nuggies. So no warm up, no sleep, or chicken nuggies.
On the pre-workout, the line I use for my athletes every time is, if you need something to get you out of bed in the morning when you're 16 years old to go work out, there's something else that needs to happen.
What you need is more
Other
sleep.
things are there's an issue. I'm gonna start. Okay, so I got to pick my favorite one. So I would rather someone not do a warm up. So I'm gonna start warm up. No warm up. I'm going to bench chicken nuggets, and I'm gonna cut no sleep.
All right.
Yeah.
I have a hot take on warm-ups. Are you ready for this?
Yeah.
Yes, let's have
hear
it.
I think specific warm-ups are kind of a waste of time.
Mm-hmm.
Okay.
What do you mean by
I
specific?
think a cardiovascular warm-up is more important than a specific warm-up.
So you're talking,
The reason
let's just get moving, like go for a run, do some jumping jacks, that kind of warm up.
Mhm.
Okay,
Exactly.
got you.
Exactly. Because we want to get specific on our warm-ups, which is I understand the theory, and
Yeah.
I might get some hate on that,
Right.
but I think that we undervalue our nervous system's ability to get excited and do the things that we want. Like we are compensating machines as human beings, but sometimes we don't get our nervous system ramped up enough to actually do the things that we want. And so, like if you look at Rory McIlroy is I'm a big golf guy. I love Rory McIlroy. And there's a video that he talks about when he's got to hit a really big pressure shot and he's got to like hit a big drive, we'll say. One of the things he does is he actually kind of excites his nervous system. So he almost gets himself going a little bit. One, that keeps the blood pumping so your brain can actually get the oxygen. But then two, it allows his body to kind of be within himself. And so, as long as you're not having kids that are like over anxious after they do this, but getting the body moving, I think is plenty for that, especially if it's some sort of full body warm up, plyometrics or things along those lines, then I'm good with that. So I'm good with
Sweet. Love
Sleep, I think, is the most detrimental thing that you can do to your body, whether we're talking high school athletes or you and I.
You're talking no sleep.
Sleep is the number one thing that people mess up.
Yep.
Yeah. Kathy was, Kathy's like, are you not feeling well? And I was like, no, I didn't sleep last night. So
there you go. There you go.
Okay. Great. I'm gonna all right.
Yeah.
Oh gosh, I'm better.
Hey.
Yeah,
Yes.
that was good. That was
Good episode, huh?
All right, last one. Ready? This is an important one. Okay. Maybe the most relevant of all of these. Condiments, mustard, mayo, or ranch.
Oh. Back in the day, before I have a massive dairy allergy now. Back in the day, I put ranch on everything. I'm talking pizza, I'm talking chicken, you name it, I put ranch on everything. So, but now in my old age, I love mustard. You give me a spicy brown mustard, so I'm going to start mustard, I'm going to bench mayo, and then I'm going to cut ranch. Mayo's made with eggs, and so I can still have that. So
I think you got that. I think you got that one correct. Yeah.
Yeah.
Oh man,
ranch
I love like
in the Midwest.
I love hot dogs. That's my guilty pleasure. Love hot dogs, love bratwurst. And the appropriate condiment for that is mustard. So if I lost mustard, who would I be? Who would I be? What would
I always joke in the Midwest, in my Big Fat Greek Wedding, the dad used Windex on everything.
The Windex, yeah.
In the Midwest, we use ranch for everything.
Oh my gosh, yeah.
Yeah.
Rub some ranch on it.
Yeah.
That's right. I probably lost like 12 patients just with that answer alone. So, but
when you were on the sideline in Troy, was it like, oh, I think I might have like torn my ACL. You're like, I got this.
That brings up you want to hear my favorite story of a sideline moment?
Yes.
So my last one here. I had a kid that was cramping. It was a horrible hot day. Whole team was cramping. I had run out of salt. So we were out of everything. And I'm like, oh my gosh, what am I going to do? So I started to think about, well, I need something with some high sodium in it, but with no sugar. So I saw the concession stand. The first thing I thought of was, well, ketchup is too sugar. That's not going to help. But mustard, no sugar in mustard.
Yeah.
Made with vinegar. It's high in sodium. So I ran over, and we're at an away team, and so there's a big long line for the concession stands. And I ran over, and I just sneakily snagged this giant Costco-sized bottle of mustard, and I'm squirting it in guys' mouths. On the side. They still joke about it with me. Yeah, I still get the message all the time, like I still can't eat mustard.
Well, and I was talking with our high school trainer, and she said that it's kind of the sourness that helps too. It's not just
pickles. Same with pickles.
Same with pickles.
Oh yeah.
So she has warheads in her kit, and so if kid gets cramps, you're getting a warhead. Yeah, and so you got one kid.
The sourness comes from sodium.
Yeah,
it's really really high salt. It's really concentrated salt.
I got a little suspicious where there's one kid who never plays and he's getting cramps all the time. Just, oh my hamstring, my eye.
I need a warhead.
Yeah, give me some warheads. You got some more? You don't? Okay, I'm fine.
Okay.
I'm good.
Shoot.
All right. So speaking of being good, so first of all, thank you so much for coming. This is
excellent.
This is the easiest podcast we've ever done. We just like hit play. We hit play on the Premer, and there we go. We just hit the Premer button, and there we go. No, really appreciate you coming. This was so informational. We're gonna sit around the fireplace and we're gonna play this episode with my sons.
Yeah, I think that's
love it.
Kathy, take homes.
Take homes, lean into the confrontation. Love that line. Yeah.
I'm gonna be looking for more of those signs of burnout, not just in my own kids, but also some of the high school athletes that I work with as well, because I think that's really important to spot. So, Taylor, if people want to get a hold of you, what's a good way for folks to get in touch?
Yeah, so my website is Premer Health and Perform or premerhealth.com. And
Mhm.
part of my
We'll
obsession,
put
or
this in
whatever
the
you want to
show
call it,
notes
is
too.
Yeah,
Yeah.
yeah.
Mhm. Yeah. Keep going.
premerhealth.com. And so I do virtual consults as well.
Sweet.
Especially I do a lot with other providers too if they have an athlete
Mm.
they're just struggling with. And so I love that. I have people texting me all the time about stuff like that, but also for functional medicine. And so I really got into functional medicine trying to figure things out for myself, but also because I had so many athletes that were dealing with things.
Yeah.
And so that's really my passion is, like I said, I do virtual appointments. So if anyone's out there struggling, they can't find a provider that's listening to them or ordering the right tests, go to premerhealth.com. I have free discovery calls. If you guys are, even just have a question, book a discovery call. It's the easiest way to get a hold of me and get 15 minutes of my time. And I'm always excited to do those, especially if it's someone that's a high school athlete or the parents that are just struggling with something like that. So otherwise, on Instagram, you can follow us at Premer Health, or excuse me, or Dr. Taylor Premer on Instagram.
Get him some mustard.
My best
Get him
way.
some mustard right
Yeah,
now.
that's right. Mustard, that's all you need. But yeah, at Dr. Taylor Premer and at Premer Health is where we do everything. If you like my
Excellent.
social media, it's because of my wife. So
Yes,
nothing good in my life has come from myself. It's all my wife. So
Yes.
I got to give her a
Nice.
shout out there.
Good. Okay. Well, yeah, absolutely. Everybody follow him on the gram. And if you want to get in touch with him, it's premerhealth.com. And again, thank you so much to our guest, Dr. Taylor Premer.
Yes.
This is
great.
This episode is gold.
Yes.
Gold. All right.
I
Good.
appreciate you guys having me
Yeah.
on. You guys are doing amazing things. I think
Super.
it's as someone that's had a podcast before, it's hard to continue to do it. It's an effort, but the information you guys put out for parents and other providers and patients is amazing. So keep up the good work. You guys are doing a great job.
Oh, we still don't know what we're doing, so it's not hard yet. Yeah. So no, I think that there's just one more item of business that we got to get to, Kathy, and that's that there's no I in pitch.
That's right.
Yeah.
Love it. Beautiful.